Plasmodium falciparum. Plasmodium falciparum is a fatal and serious disease that infects mosquitoes and humans. This zoonotic disease transfers from animal to human. It has also resulted in 405,000 deaths in 2018 alone. Most of these deaths were children under the age of 5. The disease is found mostly in warmer regions where mosquitoes live, like Africa, South Asia, parts of Central and South America, as well as the Caribbean. It primarily affects poorer nations because of political instability, lack of health care, and little or no immunity. For these reasons, it is not common in the United States, with only 2,000 cases a year. Despite no cure, this disease can be prevented.
Common characteristics of Plasmodium falciparum include the physical appearance of an elongated and crescent shape. Its diameter can range from 1 to 20 microns, and it is a unicellular protozoa. It belongs to the Plasmodidae family and is spread by female anopheles vectors. Plasmodium falciparum is a primary pathogen that infects healthy people. It is a parasite that involves an arthropod vector. Mosquitoes infect your red blood cells during feeding and can cause abnormalities within your circulatory system. The parasite adheres to endothelial cells, red blood cells, and platelets. Rings form along the skin. Malaria multiplies within your red blood cells, eventually causing them to burst after a few days. Plasmodium falciparum is able to avoid its host defenses by using immune evasion. It changes its surface through antigenic variation. Protozoa pathogens can also avoid host defenses by hiding within the cells, removing their protein coat, and triggering immune responses.
Malaria is transmitted by the vector-borne route. It can also be transmitted through blood transfusion, organ transplant, or sharing needles with contaminated blood. The parasite life cycle involves 2 hosts and a transmission vector. The infection begins when P. falciparum infects female mosquitoes through the intake of human blood. Gametocytes are injected from the blood into the mosquito where it develops and grows in its gut through sexual reproduction. The gametocyte transforms to a zygote and then matures to a sporozoid. This cycle takes about 10 to 18 days for the sporozoite to migrate to the salivary glands of the mosquito. When the mosquito feeds on human blood, it transfers the disease to each new host by the injection of saliva. Sporozoites are carried to the liver where schizons are released to the erythrocytes. A ring is formed and the red blood cell can mature into a gametocyte and go back to sexual reproduction. It can also go through asexual reproduction in the red blood cells as it transforms from a trophozoite to a schizon and finally a merozoite. The red blood cell then explodes and releases daughter parasites called merozoites that infect other red blood cells, continuing the asexual reproduction and causing the disease. Another mosquito is then infected when they withdraw blood from the host. Plasmodium falciparum then replicates in the stomach of the mosquito before injecting it into a new host and starting the process again.
Step 1 shows the transmission from the mosquito to the human as it injects sporozoites. Step 2, sporozoites then enter the liver, rupturing the cells, releasing merozoites, as shown in Step 3. Step 4 shows the asexual reproduction within the red blood cells. And Step 5 shows the sexual reproduction as a new healthy mosquito feeds on the host, starting the cycle again, as shown in Step 6.
Symptoms start 10 to 28 days after contamination. The disease stays inside the circulatory system for up to 7 days, but you can have symptoms for up to a year. Red blood cells carry oxygen throughout the body, so after they are infected, there is a lack of oxygen in the bloodstream due to the explosion of red blood cells. A lack of oxygen can result in weakness, headaches, pain, and organ failure. Other immune responses like jaundice, high fevers, shaking, chills, nausea, vomiting, diarrhea, muscle aches, and tiredness can occur when someone is infected with the parasite. Severe cases can result in seizures, mental confusion, comatose, and even death.
Perfect.
An official diagnosis of malaria is only reached after blood is inspected under a microscope to look for the elongated and crescent-shaped parasite. Malaria should be treated as early as possible. Anti-malarial drugs can be prescribed if you visit a doctor. The most common anti-malarial drugs are artemisinin-based combination therapies. The drug is used to kill the parasite as well as stop any further reproduction. The parasites can be completely cleared from the body, but some forms of malaria can become dormant and live in the body for years where relapse can occur. There is currently no vaccine. It is difficult to make a vaccine that can fight against all the different surfaces that the parasite can have, as well as targeting the complicated life cycle. Scientists don't quite know the immune response that would protect people from malaria.
Thanks for watching!